Lung cancer is the most common cause of cancer deaths in 2020, with 1.8 million deaths globally. Lung cancer's mortality rate can be significantly reduced if suspected nodules are diagnosed early.
Our recently published health economics and outcome research highlights the heterogeneous patient journey from the moment a pulmonary nodule is identified all the way to treatment of lung cancer or diagnosis of a benign lung condition.
I was very fortunate to participate in the research and the writing of 3 different papers on the patient journey through the diagnosis of lung cancer. The first study described the frequency and distribution of the biopsy procedures for patients diagnosed and treated for primary lung cancer. What we found was that patients had an average of 1.7 biopsies of their lung nodules prior to a diagnosis. Nearly half of the patients in this population experienced multiple biopsies prior to their diagnosis, and for the 46% of patients with multiple biopsies, the time lag between the first biopsy and the diagnosis averaged 57 days.
Every decision-making step can lead to logistical challenges, redundant procedures, patient confusion, and often prolong the path to a definitive treatment.
The second study describes the clinical pathway and characteristics of 2 cohorts of patients. The first cohort consists of patients with a confirmed diagnosis of lung cancer, and then the second consists of patients with a solitary pulmonary nodule and no evidence of lung cancer. We found in both cohorts multiple biopsies were evident in the clinical pathway. 70% of the patients in the lung cancer cohort had stage 3 or 4 disease. In the SPN cohort, only 66% were identified as receiving a diagnostic workup, and 10% had no workup at all.
Many patients appear to be facing substantial delays to receiving their lung cancer diagnosis and care plan.
The third paper describes the distribution of the diagnostic procedures, rates of complications, and total cost of biopsies for patients with lung cancer. We found out cost of biopsies vary substantially by biopsy type and inpatient or outpatient setting. Multiple biopsies are very common and can double the cost of diagnosis. Additionally, complications associated with biopsies account for 13% of total costs. As we see an opportunity for technological advancements in lung cancer diagnosis, we could reduce the need for multiple procedures and streamline the patient journey to the appropriate treatment.
However, a significant challenge may exist early in the patient journey on reaching suspected nodules due to their size and location in the lung, and achieving a biopsy sample to rule out if the nodule is cancerous or not. If a physician can reach these small or hard to reach nodules earlier, then the patient has a much better chance of catching the disease early in its progression and moving down a pathway of rapid treatment.
In 2019, we introduced the Ion Endoluminal System, a robotic-assisted endoscopy platform designed to enable the biopsy of small, hard-to-reach lung nodules when lung cancer is suspected. This is one of many innovative steps we are taking to address the unmet needs of patients and their physicians. Intuitive is aiming to bridge the gaps of the patient journey and help physicians make meaningful changes in lung cancer care.